You're very kind. Thank you. Thank you for allowing us to be here. Thank you for showing up and being here to learn a little bit more about us. And that's our goal. I'm going to give you the early small commercial, the sponsorship commercial, if you will. And then I'm going to bring up three very important people in our organization that can maybe give you a little insight as to sort of how we came about, what we've been through over the last 15 to 18 months, sort of where we are, and maybe, hopefully, maybe a little bit of insight as to where we think we're headed. And so that's our goal today. But I wanted to spend just a few moments with you before we did that, just to let you know who I am. I am the Community Relations Manager for Middle Tennessee. Basically, that means I'm the sales rep that comes out and calls on you. I have seen many of you, but there's some of you that I have not had the opportunity to come out and visit with you. We would love to do that. We'd love to tell you where we're working, how we feel like we're doing, where we feel like we're able to be competitive. But I wanted to make sure that I communicated one thing to you, and that is we need you. We need you. We'll never get off the ground doing this thing direct. We need brokers. We need people who believe in what we're trying to do. And what we're trying to do is basically bring competition to the marketplace. And that's what we're here about, what we're trying to do. Again, I won't take away from what I think Buck will do in giving a little bit of history on us as a co-op and what that means and sort of how that all came about. But that's what we're here to do. And we need you to help us bring competition to the marketplace, because until you put us on the table, really nothing much happens. And we are striving to be very broker friendly, and that's sort of my role. And I would love, again, the opportunity to come out, meet you at your office, and talk about. We are in the individual market. There's been a lot of misconceptions. When I told people first that I was working for the co-op. Oh, you mean the exchange? You are the exchange. No, we're not the exchange. Well, then you work for the federal government. No, we're not the federal government. So there's been a lot of misconceptions. But we'd like to come out, talk to you, tell you about who we are, what we do. We sell product. We are a mutual health insurance company. Nonprofit mutual health insurance company. You'll probably hear us say that, hopefully 2 or 3 times, just to try to drive that home. And our goal is to be, I have a lot of people say, what are you going to do if this act gets repealed or if this falls through? We're a private health insurance carrier now. So we're going to still be here. And that's our goal. We sell product in the individual marketplace, both on the marketplace and off the marketplace. We have a small group portfolio that we sell on the marketplace, off the marketplace. We've got several shop qualified plans that are getting quite a bit of interest in play right now. And we also are in the large group market. And so I'd love, again, to just the opportunity to come out, visit with you. We have a table out there. I don't know if you had a chance to stop by, but at that table, I really don't have much to hand out, but I do have just a handout that is our broker services contact information. It has the contact information for our community relations team, as well as our website, support services, and important numbers that you might need in working with us. And again, I'm here in the Middle Tennessee marketplace. Our office is in the Maryland Farms area, right there on Maryland Way, just a couple of doors down from the Y, and it's where we're located. And we would welcome the opportunity to visit with you, speak to you, hopefully work with you. That's what we really want to do, and help you bring some value to your customers, and that's what we're here for. So, having said that, I'm not going to spend a lot more time, but I wanted to bring up 3 people that are very important in what we do, and I thought it might be of value. Justin and I spoke about this meeting. Might be of value as a way to introduce us and get you to learn a little bit more about us, is meet these people. And I'll introduce the ladies first. Kim Carter is our Director of Provider Relations. And Kim, if you want to come on up. Kim Tipton is the Director of Clinical Operations, and I have to cheat to get these right. And then Buck Orison, who many of you already know, is our Director of Community Relations and is my boss. And so I'm going to turn it over to them and let them just sort of take it from there.
Okay. Beauty goes all the way in. So Jeff, you really stole everything that I was going to say.
Okay.
We're pretty well done. Yeah, it's great to be on the same page. We tell the same story, but it's true. So again, I will say thanks so much for inviting us here today. And many of you do know me. I've spent the better part of 3 decades in and around Tennessee in the group marketplace. No secret, you've heard it this morning, our industry is at a crossroads. We need everybody's help. You look around this room, there's a few people that are doing a whole lot of work. We need a whole lot of people doing a whole lot of work. Because, again, our industry was never healthier than when we had 10, 15 different companies bidding on a piece of business. If you guys remember that, it was a really healthy industry. Hopefully we can get back to, I don't know if we'll ever have 15 competitors, but hopefully we can have a whole bunch. And that's what Community Health Alliance is all about. Who we are, so what I want to do, how we got here, and what our future looks like. But first of all, I want to reiterate what Jeff said. Who we're not is the exchange or marketplace. People have had a real difficult time of that because, we were birthed out of the healthcare reform bill, and I'll talk about that in just a minute. And also, we're not Obamacare, okay? We're a solution to what many call Obamacare, is what we believe. So let's talk just briefly about co-ops and how we got here, and are co-ops new? Have they been around a while? There are actually a couple of co-ops, healthcare co-ops, that have been around for over 50 years. Extremely successful. Because what is a co-op? Does anybody know what a co-op is? We've got a couple of farmers co-ops and stuff. Really what a co-op is it's run by or governed by its members for the benefit of its members. All right? And being a nonprofit mutual insurance company like Community Health Alliance that falls underneath all the same regulations that every other health insurance company falls under, but with the added piece that says we're a nonprofit mutual insurance company governed by members for the benefit of our members. So any and all profits that we earn go back to our members in the way of lower costs or better benefits. All right? So we think we've got a model here that can be very sustainable going into the future. How did we come about? Well, again, that 2,400 or 2,000 plus page document that somebody stood up and said, we got to pass this to figure out what is in it. Well, now we're starting to get a glimpse of what's in it, and it's not real pretty. But fortunately, there was one paragraph in that document that talked about bringing a private market solution to the table to bring competition back into the fold. And this was a bipartisan approach, and that was to bring the co-ops to be. Had we have not seen that one paragraph in 2,000 plus pages, we may be in a single-payer system or the public option, which was very, very unpopular. So be very, very thankful. We all need to be very thankful that that was seen. So that's a little bit about how we got here. But 4 years ago, there was actually a few people that got together, and there were several large employers across the state that sponsored us to go after this federal loan to build a co-op. So worked very hard, about a year and a half, very bright people. Many of you know many of the people that were involved in the early stages. It cost quite a bit to go after a federal loan, as you guys probably know. Fortunately, we won that loan, and so we're the only co-op statewide in Tennessee. And Kim will tell you a little bit more about our networks and how we're building our own proprietary networks across the state, which is a Herculean effort, to say the least. So again, we got that loan back about a year and a half ago. Since then, we've built a full insurance company with networks, with medical management, with all those pieces across the state. So we're ready to do business. We've been doing business. Jeff mentioned that we're on and off the exchange, both from the individual perspective and the shop or small group business. But we're also very, very focused on the commercial market, because I truly believe, and we truly believe, the commercial market's going to be here. But it's up to us to keep it strong. It's up to us to use the competition that we have and support our competition. And that's what we're asking you. Take a look at us. Look at what we're doing. We're not going to fit for everybody, but then again, no company fits for everybody. So we would really, really, really appreciate the opportunity to work with you, with other folks that you work with. We do have broker meetings across the state to talk about Community Health Alliance and train on our benefits and products. We do feel that we're a little bit of a different company. And where are we going in the future? Well, if anybody knows anything about Community Health Alliance and has looked at our networks, we're in 64 of the 95 counties in Tennessee today. We're expanding into all 95 counties as we speak, expected to be complete by the end of 2014, okay, for 2015 enrollments. So great opportunity for us to bring competition to the table. People may say, well, what happens if we have people that live outside of Tennessee? Not a problem. We have rental networks that we can use outside of Tennessee, much the same as other carriers might use, okay? Even though they might use their networks. What's the future of co-ops? Well, there's 23 co-ops across the country today. Some of them are going to be very successful. We believe that ours will be. Our sister plan, we went after the loan in South Carolina, and we won that as well. So we've actually brought up 2 insurance companies in about a year and a half. I don't know if anybody's tried to do that, but, you know, 36 hours a day just ain't quite enough. It's been quite a journey, but it's been a great journey. We're building this thing right. And to give you an idea about our senior staff, obviously we have very, very experienced people in our company. We've built these programs before. We've been successful with other carriers before in building great programs. We've got great carriers in our state. We need to keep everybody really healthy and strong. And the way that we do that is to work through the competitive edge. Okay? So I'll be happy to take any kind of questions you may have on Community Health Alliance. I know that Kim and Kim want to talk about also our networks and our medical management piece. Or we can wait to the end, whatever you'd like. Okay, which Kim wants to go first?
All right. Well, hi, I'm Kim Carter, as Jeff introduced me earlier, and I am the Director of Provider Relations and Credentialing for Community Health Alliance across the state of Tennessee. I've been with the company now for almost a year and a half. Previously worked in provider relations and network development at Blue Cross Blue Shield of Tennessee here in the Nashville area. Was there for about 11 and a half years, so that's where I spent the bulk of my career thus far. So I went from one very well-established, well-known insurance company to a brand new, not so well-known insurance company. But I did that because it was such a great opportunity, but also I really believed in the mission and the vision of what Community Health Alliance, the co-op, is trying to achieve. So obviously, one of my first tasks when I came on board was to build my staff and then go across the rating areas that we're in right now and build the provider network. And by the way, I had 11 months to achieve that, which is not an easy task at all. But fortunately, I found that providers were really wanting to see more competition move into the marketplace. You know, they were interested in diversifying their payer mix further instead of really relying on, you know, those 1 or 2 big players in the market to get all of their revenue from. So we focus first on the major markets in Tennessee, Nashville, greater Knoxville area, and Memphis to really determine who our hospital partners were going to be. That's really where you have to start in building a network. And so we knew we wanted to build a narrower, more selective hospital and specialist network, and then focus on having a very broad primary care network, because those primary care providers are really the point person to care. And choosing our partners came down really to competitive pricing, to geographic coverage, that access that we needed, interest in clinical integration and quality to care, and so forth. And we realized that exclusions in the network can be problematic for the sales team and for the brokers. Because let's face it, people are loyal to their providers. They want broad access. It's what they're used to having. But the narrow networks are really the wave of the future because for us it helps, and really the system as a whole, contain cost and in turn help us offer more affordable premiums to our customers. So like Buck said, today we're in 5 of the 8 rating regions, as they're called. Memphis, Jackson, there are 2 here in Middle Tennessee and in Knoxville. And like Buck also said, we're in the process of expanding out our network in Chattanooga, the Upper Cumberland Plateau region, and Tri-Cities market. So hopefully we'll have a good network established in those areas by late summer. That's the goal. And so the community relations team can begin selling there hopefully in late summer. And then on the exchange, we'll be ready for open enrollment, which I believe begins mid-November this year. So we will be statewide by the end of the year and in all 95 counties. So we are focused on offering to individuals and small businesses that alternative, affordable option, both on and off the exchange, as well as providing them with a quality provider network that will really guide them through the healthcare system to meet both their acute and chronic needs, improve their health outcomes, we hope, and overall wellness. And we will try to achieve that with providers by offering patient-centered medical home programs, pay-for-performance programs, and again, those clinically integrated models that will help our customers. So that's really the high-level overview of what I do. Does anybody have any questions for me? Yes. Mm-hmm. We are looking to tap into some of those IPAs, ACOs, PHOs, all the acronyms that you probably are familiar with. But the contracting strategy, we've really gone out and just said we're looking for competitive rates with all the main payers that are available to you right now, particularly Blue Cross, because that's our biggest competitor. And just saying, we need your help with that, because if we don't get competitive pricing, then we can't be successful. We won't survive. And so that's gone over very well with the provider organizations that I've met with. And we are focusing on, it is sort of base fee schedule to begin with. And then from there, we're developing out into getting those performance measures into their contracts and, gain sharing and hopefully even risk sharing down the line. So we are working to, it's an evolution. So, any other questions for me? Yeah, sure. Jeff asked me to outline the networks, what they look like today in each of the markets. So in Memphis, we have the Baptist Health System. We are working with St. Francis. We have the Med, which is the big tertiary hospital there in Memphis. In Jackson, we're working with West Tennessee Healthcare System. They have one of the big hospitals there in Jackson, as well as the Jackson Clinic. And then here in Middle Tennessee, we have Vanderbilt and HCA. So that means that the St. Thomas system here is excluded from our network. So we just have 2 of the 3 big systems here. And then, of course, Vanderbilt Medical Group. We have some of the more community-level hospitals, Williamson, Northcrest, Murray Regional, all of those are in our network. And then over in Knoxville, we're working with the Covenant system and the Tenova system. And then we also have Summit Medical Group. So those are the key players in each of those markets. Anybody else? right, well, I will pass the mic. Oh, I'm sorry. Yes.
I realize that I, I realize that on the individual market, when you file the rates, that you had no idea, where to start.
Right.
Are you going to be more competitive with the Blues when you refile this year? Because
Yes.
they've pretty much taken over the individual market.
Right, that's true. And the reason for that, we did have to file our rates to CMS back in April of last year. And so at that time, being a new company, we didn't have any claims history. We didn't have hardly any data to draw from to help us. And at the time, I think we had one, maybe two provider contracts signed, and knew what their rates, looked like. So it really was a guessing game and a shot in the dark, so to speak, for us. And unfortunately, we realized 3 weeks after we filed our rates that we had missed the mark big time. So we really had to shift gears and focus more off the exchange with small group business, where we were very competitive, and large group business also. Correct me if I'm wrong. But thank you. But yes, we now, of course, have our network established in those 5 key regions. So we have a very good understanding of what our provider rates look like, so we can plug that into our analysis to help us predict what our rates will look like for 2015. So we do intend to be very competitive on the exchange with the Blues and others. We are still working on getting that more rounded out up there. We are having to use some wrap providers in the interim to help us fill in network adequacy gaps. There are certain guidelines that we have to follow and make sure that there are key specialties up there that are filled by a provider. And if we weren't able to directly contract with those, we did have to fill those in through multi-plan temporarily. But we are still trying to convert those over to direct contracts under Community Health Alliance. But we do meet network adequacy standards in our network. Yes. Sorry.
We are in the process of a full product revision. Many of you may or may not know Linda Johnson, who came out of another company that we all work for, and from product development, and really bright actuary. And of course, we're working with Milliman and those folks to make sure that the products that we hit the street with in 2015 are the products that people want to buy. Yes, sir.
It's actually been moved to late May. I think there's a date range between late May to late June. So there's about a month, 3 weeks to a month that we can file, is my understanding. Now, unless that gets changed again, that's what we're working with right now.
It's kind of like nailing Jello to nail down the times.
Yeah.
Right, but the point is it would still be an extremely small window for any of the carriers.
Right. That's true.
Still
true.
Yes.
True. But at least we're further along than we were last year. So. Anyone else? Okay. I'll hand it over to Kim Tipton.
So one of the prerequisites to come to work for this company, you have to be named Kim. So, in fact, we have another Kim that works with us as well. So that gets interesting on conference calls. But I am a nurse, and I had the opportunity back in the fall of 2012. A recruiter called me and said, I want to talk to you about a position. It's a new health plan, and it's in the state of Tennessee, and we're only looking for people with experience. And I thought, well, I don't know. What's the culture like? What does this health plan offer? What makes it unique? What makes it different? And he said, it's all about the people. And if you'll come meet the executive team, you will hear that in their passion, in their voice, in what they talk about. And as a clinician, that gave me the opportunity to bring up something that I never had the ability to do before. So helping people, but doing it with the tools that I needed. So we have our case managers and disease management nurses and utilization management nurses. They get to function all on one technical platform. So they get to see everything about the member, and it's not, we don't have to transfer members from department to department or to different vendors. We have it all right there in one system. So we can help the member with everything. We get to see the claims that come in, the pharmacy benefits that come in. We know their gaps in care. And this is really special for those individuals. Some of these have never had insurance before. They don't know how to navigate the system. They don't understand what a deductible is. They don't understand what a copay is. They don't understand that if you're sick, you just don't go to the ER. So that also has given us the opportunity to work with the different PCPs that we have in network and help these individuals to obtain a physician and then communicate back with that doctor what their initial care is, especially if they have case managers there, like in a medical home. We have the opportunity to call these members back. Customer service is huge for us. Because that was always an issue that I experienced. I would call someone, I might get a first name, but if you call back, you never got to talk to that person again. And we have the opportunity to do it different. So if we talk to that patient, we call them back. Did you get what you need? Did we walk you through the system? Do you know what you need to do next? Or if they call back, they can get to the person that helped them before. And I think that's huge. Building those relationships and helping those people, that's what I get to do every day. One of the other things is we have the small employer group model, which is wonderful. I never had that opportunity before. I always worked with the larger health plan groups or large employers, and the little man kind of got left out. They didn't always have the products, wellness or disease management or case management because they had to purchase it and they couldn't afford it. We offer it. It's a benefit. That is huge because we know for that small employer that one catastrophic claim could destroy them. And I might have the opportunity to prevent that through some of the programs that we offer.